My name is Gabrielle Saunders, and this is an overview of my practicum experience this past summer from April 22nd through August 22nd of 2021. I worked with NAMI, the National Alliance on Mental Illness, in West Central Indiana, located near Purdue University in Lafayette, Indiana. Just a little bit of background on NAMI. NAMI is, like I said, it's the National Alliance on Mental Illness, and it was located in Lafayette, Indiana, at 913 Columbia Street. However, I live in the Chicago area, so I completed my practicum via remote learning, partly due to the pandemic as well. My preceptor was Sherry Moore, the executive director of NAMI West Central Indiana. Sherry Moore is a Purdue graduate, actually, and she majored in law and society as well as psychology. The mission of NAMI West Central Indiana is to advocate for and offer support, effective treatment, and education for individuals and families affected by mental illness in our community. Basically, it wants to support and help everyone with mental illness who does not have a voice, and wants to keep in mind that there are others affected by those who have mental illness because we don't live in a bubble. And the target population, like I said, is those who are affected by mental illness and their families and friends. It especially includes those who can't advocate for themselves. The jurisdiction of NAMI West Central Indiana includes 8 different counties: Tippecanoe, Benton, Carroll, Clinton, Fountain, Montgomery, Warren, and White counties. So it covers a wide range of areas. NAMI is a grassroots industry, so it has separate branches. For example, there's one near where I live, NAMI DuPage. There's NAMI Metro Suburban in Chicago area, but there is a national organization for it as well. For my practicum, I had several responsibilities. I added to educational presentations about mental health and the workplace that was already previously developed by NAMI. I proofread the PowerPoint, and also added to a lot of the self-care section. I analyzed the results from a study that Purdue did about cell phone usage as it relates to mental health. So it looked at the average amount of cell phone usage, and then it looked at how participants self-ranked their mental health, and then it compared that to. And I kind of analyzed the results and looked at the general trends from it. I also did a lot of research on a program idea for the living room, and I got in touch with NAMI DuPage and NAMI Metro Suburban about their existing living room programs. So the living room is a project we're trying to start up. It is basically an alternative to the emergency room for those who are having a mental health crisis and don't know where to go. These individuals would be seen promptly. They would see a psychiatrist and a peer support staff, and then they would get follow-up resources afterwards. They would not be charged any money. They wouldn't have any wait times, really. And hopefully this would improve the psychological well-being of the county and the area. So what I did for that was gathered information about wait times and success rates of other mental health treatments, and I also wrote a grant proposal for this project and a grant proposal poster for this project. Other things I did, I made a spreadsheet about crisis intervention police data to be organized for that. I created a presentation on bullying and why and how and the different forms of bullying. I organized different aspects of the annual gala, including negotiation of donations. And I also, I'm going to, in September, assist in crisis intervention training for the police force in the Lafayette area, in addition to all of the major projects that I accomplish. The major project I did was COVID-19 and mental health. It was a presentation with audio and visual aspects on statistics about mental health during the pandemic, also with tips for better mental health during the pandemic. I presented this to the NAMI Connection support group, and then I created a survey for participants to fill out afterwards and analyze the survey results. Based on the results of the survey, I appended the presentation to be more successful, and then I gave the resources to the executive director of NAMI West Central Indiana so she could either post it on her website or show it to other support groups. The other project I worked on, as I touched on this before, worked with NAMI to develop their crisis intervention teams training that's going to begin on September 13th. I plan to attend the training and participate in it myself, and also to aid in necessary tasks there and gain information on crisis intervention training. So I read several books about it. I watched a lot of documentaries about it. And then I researched crisis intervention training and researched how NAMI West Central Indiana could be CIT certified. So I got information about that from my preceptor, as well as attending regular meetings of the CIT committee and giving feedback to them. My third project was the NAMI Connection Support Group analysis. I tracked the attendance of the support group over 2 months, and then I graphed this data and I made observations of the data and hypotheses about data trends. I created a post-group and a pre-group survey that were given to support group members to fill out electronically. This was due to not having the group meet in person because of the pandemic. I incorporated the necessary United Way metric data into the surveys, so those could be given back to my preceptor and back to United Way, who's a partner with NAMI West Central Indiana. And then I also analyzed themes and points of both the surveys and created a summary document of the observations I made and gave this both to the executive director of NAMI and the director of the support groups. So, practicum relevance. So at first blush, stuff like coordinating wine donation is not relevant to public health. However, this can be tied back to public health because, getting the wine donations will get more money and support for the gala, which would get more money for projects like the living room that we're desperately trying to fund by applying for grants for it, which ultimately benefits public health. Studies were relevant because educational interventions were carried out and then analyzed for success afterwards. Population data was tracked and analyzed, which is a relevant public health task, and then my grant proposal poster was actually used in presentation to a potential funder for the living room project. I aided in CIT development for law enforcement, which is useful because police doesn't necessarily know how to deal with mental health crises, and that's the exact purpose of CIT. Practicum was relevant to me because I have family members with mental health comorbidities, and I'm very passionate about this topic. So I really liked having this personal application in everyday life. I learned a lot of lessons, including that I need to be more proactive in reaching out to available resources. I know a lot of people with public health backgrounds, but I didn't ask for their input. I work well when I have a schedule planned out, but I didn't work very well when there were deadlines looming and planning got chaotic. I also felt like I got too comfortable working remotely, so when the time comes for me to interact with other people, I get nervous, and I think that's also partly a result of the pandemic. Competency reflections. One key competency is communication in public health. Accomplishments are achieved as a mutual effort, and everyone has a different skill set to bring to the table. It required me to constantly be reaching out to people via, the internet, so email, call, texting, since I was working remotely. Another key competency is interprofessional interaction, and I worked with people with a background in law enforcement for the CIT training, and then I worked with people who had a background in psychology at NAMI. My personal background is in nursing, so we all have different specialized skill sets that can build on each other's. My most beneficial accomplishment, I feel, was my grant proposal for the living room and the poster I created. It was presented to potential funders, and the results were positive, so I got to see firsthand how my advocacy can make a difference. In conclusion, I want to acknowledge Dr. Obuli-9 for being a wonderful mentor during my practicum at Purdue, and I also want to acknowledge Dr. Jim Amell for helping me find an appropriate practicum placement that was suited to my public health passions and to get me on track for success. I'd like to acknowledge Sherry Moore, my mentor, for guiding me in my practicum, being patient, and making an effort to involve me in new learning experiences. And then I wanted to acknowledge NAMI West Central Indiana as a whole for involving me in their practice and welcoming me as a valid peer team member. Finally, I want to thank my family for being supportive during the program and during the practicum. And the only questions I have leaving my practicum are for myself. Once I have my degree, I need something to do with it, and I want to make a difference, and I want to gain experience in different aspects of public health to see what I'm most passionate about. And my practicum experience has been most beneficial in showing me that I can truly like my work, and if I like my job, I won't have to work a day in my life.